Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are gonna go over a movement problem that someone suggested in the comments, and that is that they said their hip drops. So not the side that they're having the weakness on, but the opposite hip drops down when they stand on their involved leg. And I'll go into why that happens and the exercises to help with this problem. But other people that might benefit from this exercise progression is when you're walking, if you really lean your trunk towards your weaker side when you're standing on that leg, that's another sign that you might have a similar weakness going on. Or if when you're standing on your involved leg, your opposite shoulder feels like it drops or it wants to rotate towards your involved side when you're trying to stand on your weak leg, your stronger shoulder kind of rotates toward that leg. That's another thing that I see that is kind of in this same category of problem. So if you are someone that has any of those, then stick around because I'm going to help you learn the exercises that you need to do to help correct this. So there are a few things that cause that to happen. One is weakness in the hip abductors. So when your hips are here and you go to stand on this leg, the muscles that abduct the hip, when they're weak, that hip will drop. That's also when you have weakness there, that's why you lean your trunk way over. Those are all signs that you have weakness in the hip abductors. The other reason that I see this sometimes, or I really see that trunk lean to that side, is that you either have tightness or spasticity in the adductors, so the muscle on the inside of the hip that pull that leg in, or you have tightness in your hip flexors. So I want everyone who spent any amount of time in a wheelchair, either now or in their early recovery, to pay attention because your hip flexors are definitely probably tight from the time that you spent in that wheelchair. So tightness in any of those can also cause that hip to pop out to the side or cause your stronger hip to drop. The other time that I see this a lot are if you are someone that's had a stroke and you're in a wheelchair for a long time, you have a tendency to sit in a wheelchair shifted more onto your stronger side. So then what has a tendency to happen is the side over here, these trunk muscles over here get short. And again, that will cause some weakness in those hip abductors and you will kind of get that hip drop look when you walk. What do you do to fix it? So the easiest exercise that really anyone can do is just sitting with a TheraBand around your knees and just pushing out. That's gonna help to strengthen some of those muscles that abduct the hip. And I get this question a lot, how many times should I do this? You can do it as many times as you want. It's more of an endurance muscle. So you want good quality movement, but that whole 3 sets of 10 or whatever that a lot of us did when we were playing sports or gaining strength, we're really trying to build control. So you can do this, I would say set a time limit. Maybe do it for 30 seconds, nice, good, slow, quality movement, and do 3 or 4 sets. Now the way to advance this and really isolate those glutes is now push out on that TheraBand and stand up. So you want to keep your bottom back. What I see a lot of people do if they have weak glutes is their knees slide forward and they keep their bottom kind of tucked in. You want to keep your bottom out over the chair for the majority of the time that you're standing up. If you can't do that because you just have too much weakness, skip it because you're going to compensate. You're not going to get the benefit of this exercise. So just stick with the one sitting and moving your legs out to the side. I'll go over some other exercises that you can do that are going to be a little bit easier where you can maintain that quality of movement. The next exercise that is super duper important, and I'm sure a lot of you are already familiar with it, but it's laying on your side and just lifting the leg up to the side. I call this the Jane Fonda. It's amazing to me that all I have to say is the Jane Fonda and a lot of people know what I'm talking about. It just always reminds me of Jane Fonda. So I call this the Jane Fonda exercise, but it is just a leg lift out to the side. Now, the mistake I see a lot of people make is they either turn their knee so it's pointing upward and they compensate by using their hip flexors. So if that is you, you want to make sure you're leading with your heel. So you're on your side and you want to try and think about leading with your heel when you lift the leg. So the heel should be coming up first. That'll help keep that hip straight and really isolate that glute and that tensor fascia lata, or TFL. And then if you get really good at that, you can add multiple planes of movement just to add an additional challenge and really work on that hip control and that movement quality of all the hip rotators with the hip abduction. And I love this exercise. This will really challenge your stabilizing muscles in that hip, but you're gonna drop that knee down and do a little tap on the mat. So you're gonna bring that knee up and tap it down and then lift that leg back up to the side. Now the key to this one is you do want the knee to stay lower than the foot the majority of the time, because you really wanna incorporate those rotators, especially when you're coming back up. Again, a lot of times people want to lead with their knee and kind of compensate a little bit with their hip flexors. Also, you want to pay really close attention that you're staying on your side and not rolling onto your back. That's another kind of compensation or movement quality problem that I see when I see patients doing this on their own. So I've done a whole video on tall kneeling. I love it. I'll put a link for that video right here. But I would always add tall kneeling into any activity. It takes the ankle out of the picture, so you don't really have to worry about what your ankle is doing, and really allows you to focus on that hip control. And really in this position, you can strengthen that involved leg either by lifting the involved leg out to the side or lifting the uninvolved leg out to the side. Either way, you're gonna strengthen that hip. What you really wanna pay attention to is that your body is staying in a straight line and that your hips aren't flexing, your butt's not popping out to the back for this one. That's really, really critical to really engage those glutes. That's why it's so beneficial, is because you're learning how to engage those glutes without really having to be fearful of falling, because it's a little bit safer being lower to the ground in this position. So I love this activity. I love this exercise. And now we're going to go to some standing exercises. I love this stool. It is a great way to make sure that you maintain your balance for safety. I will put a link for the stool in the description below, but it's a great handle to hold on to when you're doing your standing exercises. And then basically you're just going to move the leg out to the side. Again, this is another one, just like in the tall kneeling, where you could do it on either leg. You could lift your weaker leg up out to the side and your stronger leg out to the side, and they're both going to work that weaker leg. The thing you want to make sure is whatever leg is on the ground, that hip's not popping out to the side, that you're keeping that body nice and straight. Your knee is on top of your foot, your hip is on top of your knee, and everything is lined up. Your shoulder is right over your hip, making sure that everything is in a straight line on that side. And then to advance that, you can do lateral toe tap. So you're gonna toe tap your foot onto a step. The way that you make this harder is you just keep making that step higher and higher. Again, you could do this with either leg. I'm showing it with the uninvolved leg so that the stronger leg is really having to hold you up as well as stabilize you. And actually, believe it or not, the leg on the ground is abducting. So you're strengthening that leg when you go to try and put that foot up on that stool. Having the wall on that side will help initially to help you maintain that alignment. So if you can't maintain a straight line on the leg that you're standing on, please, please, please use the wall until you get a little bit more strength and a little bit better control. Remember, quality of movement is way more important than progressing any exercise. And I say that a lot, but it's worth repeating. So if you're losing the quality of the movement, go back down to an easier exercise that you can complete successfully with good quality movement. And then this next one is really, really hard. So this is only for someone who has really, really, really good balance, but you're gonna do lateral step up. So now you're gonna step up onto the step. Again, this is now gonna challenge the muscles around your knee. So now you're really working on coordinating your knee muscles and your hip muscles which is critical for walking. When you go to take a step and you load that leg, or that leg needs to accept your body weight, which happens as you pick the other leg up, you really need good coordinated control between your knee and your hip, meaning your knee and your hip really need to be communicating with each other to make sure that you can get a nice smooth step. So this would be a way to work on that. And then this last one, like I call this one the monster walk. You're gonna go back to using that TheraBand, and you're basically just gonna side step. If you don't have great balance, you could do this along a countertop. The key to this one is that you are not leaning your trunk side to side when you go to take that step. Everything should stay in alignment. You shouldn't see that hip drop, because that's what we're trying to correct. So definitely, if you don't have the strength yet, usually that's a sign that you don't have the strength yet for this. Don't go onto it, because you're gonna lose that quality, and then you're missing out on all the benefits of this exercise. And that is it. I hope you all found this exercise progression helpful. If you have any questions or comments, leave that in the description below. If you haven't yet subscribed, please subscribe. It really helps me in the eyes of YouTube to show these videos or suggest these videos to more people, so it really does reach more people, the more of you that hit that subscribe button. If you haven't turned on notifications, turn on notifications so that you'll be the first to get notified when I post new videos, and keep working. Never stop working. I told this to a patient the other day. We all invest time into our health every day, whether or not we've had a stroke. So thinking that you're not gonna get any better, or that these things aren't gonna help you, is just a lie. And don't buy into that lie. You've got to move. And in every single one of these videos, I'm giving you ideas and suggestions to just stay moving. It's not always gonna be fun. You're not always gonna wanna do it. But the more you do it, the more you're gonna see the benefit of it, and the more it's gonna motivate you to keep going. So I feel for you all that are feeling discouraged right now. And I commend you all that are keeping a positive attitude through your recovery. It's definitely gonna pay off. So keep going. Moral of the story, move. So I enjoyed being with you all today. Thank you for making it to the end. I appreciate you all, and I look forward to seeing you all in the next video.